Today I will talk about the importance of a blood test called serum ferritin in patients with restless leg syndrome. First, a few words about this condition. Restless leg syndrome or RLS is a very uncomfortable condition where the person has discomfort in the legs usually, and the discomfort feeling can be described as some kind of achy sensation or pain or discomfort, and then this tends to occur more when the person is resting. So more the person tries to rest, more severe are the symptoms. So typically they get worse when the person lies on the bed and tries to sleep, and they can also occur when the person is sitting for a long time. That can happen while long ride on a plane or long road trip, and those times become uncomfortable, and then the person has a great urge to move the legs because standing or walking only those or jerky movements of the legs, so those leg movements only give relief to the symptoms. So as a result the person doesn't sleep properly and feels sleepy in the daytime. So it's a quite disabling condition also. There are many underlying causes for RLS, and here I am focusing on a very important cause called iron deficiency. So, iron deficiency is closely linked to RLS, and it correlates more with the brain iron levels than the blood iron levels. So, like normally you would think, okay, if it is due to iron deficiency, let us check the serum iron or the blood iron. But in patients with RLS, the blood levels of iron may be normal, only the brain iron levels may be less. But it is not easy to check brain iron levels because they need specialized imaging or scans which may not be available in the clinic. So one indirect method of assessing brain iron level is serum ferritin, which correlates with the body stores of the iron. So serum ferritin is a very easily available test which can be easily done. The reports can be obtained on the same day. So if you have a person with RLS, check the serum ferritin levels. If the serum ferritin levels are low and the person has RLS, then we need to give iron supplements as well as RLS medications, which include medications like gabapentin or dopamine agonists like pramipexole, droperidol, and only then the person will show improvement. And after giving treatment, we can recheck the ferritin levels. If the ferritin levels are getting better with oral iron, then oral iron treatment may be sufficient. But if a patient continues to have low serum ferritin or the RLS symptoms continue despite giving oral iron, then such patients will require parenteral or the intravenous iron injections. So this is one more important thing to note is that those who have iron deficiency or ferritin deficiency, they are the persons who have something called augmentation, where over a period of time the dopamine agonists like droperidol and pramipexole, they become less effective and higher doses are required. So it is also useful that if you have a patient with say RLS and low serum ferritin, it may be worthwhile using medications like gabapentin as compared to droperidol or pramipexole, so that we can avoid this risk of augmentation or this inefficacy of dopamine agonists.